Today, let's talk about migraines. If the patient's migraine is due to a mechanical misalignment, it can more than likely be helped by chiropractic care. Let's look at the science behind it. A lot of the migraine suffering patients that I have helped in the past have had an obvious and easily fixable misalignment in their upper neck. It might surprise you to know that the artery which supplies blood to the midbrain runs through the bones in the transverse processes of the vertebrae in the neck. It's called the vertebral artery. How does this cause problems, you ask? Because this little artery runs through the bones of the neck, and if there is a misalignment in the neck, then the blood flow through that artery could be changed. And if you can imagine changing the blood flow to something as intricate as your midbrain, this can cause potential problems. The bone on the back of your head is called the occiput. The bone directly below that one is called the atlas. The vertebral artery wraps around the atlas and enters the brain area right past the occiput. If a patient presents with migraines, more than likely there will be what's called a counter-rotation between the occiput and the atlas. This just simply means that the occiput is torqued one way and the atlas below it is torqued the opposite way. This puts a lot of stress on the little vertebral artery that supplies the much-needed blood to the brain. Patients with this misalignment more than likely will have additional symptoms, which could be sleeplessness, restless sleep, neck tension, and maybe even some vertigo. If you have migraines, then you need Thrive Chiropractic to check for counter-rotation in your upper neck. You will be amazed at how good we can make you feel.
Are you ready to thrive instead of just survive? Let's get started.